People in pain from a cervical herniated disc will frequently inquire about acupuncture. To find out more about this, I met with Gary Sapolin, who is an experienced acupuncturist here in New York. Patients love acupuncture, so can you tell us what it's like when a patient first comes to you with a cervical herniated disc? Is there an evaluation, or what's the first visit like?
Okay, well, the first visit, usually we don't know the history yet of the patient, so the first thing we do is have them fill out a health questionnaire. A little simpler than they'll usually see in a medical office, describing their history. I'll talk to them, ask them questions about the nature of their pain. If it's for cervical herniated disc, I want to make sure that's really what I'm treating. So I'll ask them if they've seen a medical doctor, if they've had any evaluations, MRI or whatnot. And then we'll proceed with a little bit of an examination, just seeing where the weakness is, history-wise, if there's tingling, numbness in the arm. But in the first visit, after a little bit of evaluation, we will go ahead with a treatment. The beauty of acupuncture is the worst case scenario is it won't work, but it can't do any harm. So it's, even if someone doesn't have a herniated disc and they think they do, when we're treating that, it can only help the neck pain.
So even in the first visit, they can expect to have needles put in?
Yes.
Okay. So what does acupuncture do for the cervical herniated disc? How does it work?
Well, it works in a few ways. The Chinese, over thousands of years, have figured out that there are various points in the body that they call acupuncture points that are along meridians, which are pathways of energy flow in the body. They've identified these points as places where you can access the body's energy, and by stimulating these points, get a reaction that is beneficial to the human body. There's a lot of question about how it actually works, and especially in biomedical terms, but the bottom line is it does something to stimulate blood flow. They've shown that acupuncture is a vasodilator, so it promotes blood flow. They think most likely the way that it works with treating pain and inflammation is it causes the release of endorphins locally. So there are a couple of other ideas of how it works, but what we know just empirically is that it helps reduce pain, swelling, inflammation. So it promotes an environment that allows for healing wherever the problem is.
The bottom line of acupuncture is, if you're not afraid of needles, it's terrific. It's very safe, and it will help with some of the pain. Now, some of the problems with acupuncture I see are that it's not going to solve the problem of the herniated disc. And also, from my experience, it's sort of temporary. People do go to acupuncture, they feel better for a while, but again, the pain in the arm and the neck will come back. But if you have a good acupuncturist and you're willing to spend the money on it and you're in pain, I think it's something worth doing. Let's say you have this much pain, and then you have the acupuncture and it brings the pain down to here. That's this much pain you've just gotten rid of without medication and in a safe manner. And this may make the difference between you being miserable at night and being comfortable. So bottom line, acupuncture is, I love it, it's worth a try, and I think it may help reduce some of the pain that you're suffering with.